I was first drawn to naturopathic medicine when I read the 6 principles. These 6 principles guide any naturopathic doctor as they treat their patients on a day-to-day basis. The first principle is the healing power of nature. This is the inherent ability in every human body to heal itself. The second principle of naturopathic medicine is first do no harm. In naturopathic medicine, this principle guides us through a therapeutic order. We start with the least force interventions, including nutritional supplementation and diet and lifestyle counseling. At the bottom of this list are drugs and surgery that may be higher force interventions that come with more risk. When we can balance the risk and benefit and help our patients, we've achieved success. This principle guides me through a therapeutic order that includes drugs and surgery, although those would be the last tools that I would reach for to treat a patient. I would like to start with diet and lifestyle modification, including better nutrition, potentially nutritional supplements, helping their structural body, as well as adding other low-force interventions. The third principle in naturopathic medicine is doctor as teacher. Having at least an hour with patients gives me the ability to share a lot of the insights that I've collected over the years, whether it was in medical school or whether it was at home applying some of the advice that I am now giving. The fourth principle of naturopathic medicine is to treat the whole. This is important because patients come in as part of a larger context. They have families and jobs and environments in which they live and work that all contribute to whether or not they suffer from chronic disease or can achieve optimal health and wellness. For example, if I suggest that a patient eat all organic food and there are no venues for them to get organic food, there are no stores, they live in something called a food desert, where the only option is a 7-Eleven or a McDonald's, it's going to be extremely difficult for my patient to be able to execute that advice. What I have to do is then work with that patient to develop creative strategies so that they can improve their nutritional status with the resources they have at hand. The fifth principle of naturopathic medicine is to treat the cause. I think that this is one of the most important principles. If we never find the root cause of disease, we cannot ever truly find a cure. Instead of just masking symptoms with band-aids, what I truly value is finding the root cause. This takes a little bit of detective work, but is just as important as finding a diagnosis. For true and lasting health, we must find the root of the problem and solve it. The last principle of naturopathic medicine is prevention. Prevention has 2 aspects, the first being early detection and screening so that we can prevent progression of diseases like colon cancer, cervical cancer, and diabetes. The second aspect of prevention is to identify risk factors, such as toxins or genetics. This allows doctors to make recommendations specific to the patient to prevent the onset of disease from ever happening.